Introduction. Reporting of communicable diseases to the Public Health Department is fundamental in the control and prevention of infectious diseases. Healthcare providers are required to report either suspected or confirmed cases of reportable diseases as soon as possible. When infectious diseases and related conditions are reported, medical therapy and other public health preventive measures are put in place to avoid further spread of the disease. Health promotion helps individuals to take charge of their own health. Health promotion addresses persons' behaviors towards many environmental and social factors that directly or indirectly affect their health. Confirmed or suspected cases of reportable diseases should be communicated within 24 hours. Typhoid fever is a bacterial infection which affects human beings. The essay addresses the epidemiology of typhoid fever, cause, symptoms, prevention and treatment as one of the reportable diseases in South Carolina. Targets. The research targets children. They are most vulnerable to food-borne related diseases. Poor sanitation practices predispose children to diseases like typhoid. In some cases, parents neglect their children, which increases the risks of contracting the disease. Epidemiology and statistical facts. Typhoid fever, also referred to as salmonella fever, is a global sickness. Typhoid fever mostly occurs in kids and young adults between the ages of 5 to 19 years. Causes. Typhoid fever is caused by gram-negative bacteria known as Salmonella typhi. The bacterium is transmitted through ingestion of water or foodstuffs which are contaminated with excreta of an infected person. The bacteria cause perforation of the enteric wall, hence the name enteric fever. Salmonella typhi thrives well at temperature of about 37 degrees Celsius, which is the normal body temperature. Symptoms. The disease is mostly characterized by a high fever above 37 degrees Celsius, which slowly progresses to a maximum of about 40 degrees Celsius. Prolific sweating and a non-bloody diarrhea also observed. An inflammation of flat-colored pustule is occasionally observed. When not treated, typhoid fever takes 4 stages. Each stage lasts for a period of 1 week. The first week is characterized by increasing temperatures, headache, and general body weakness. In the second week, the temperature remains constant, 40 degrees Celsius. The patients develop calm delirium, which may sometimes become agitated depending on the severity of infection. Abdominal pains, constipation, and diarrhea with a characteristic smell occur at this stage. Enlargement of the liver and spleen also occur, and later the organs become soft and tender. There is a strong reaction of anti-O and anti-H when the Widal test is performed during the second week. During the third week, complications like encephalitis, perforation of the intestinal wall, and metastatic abscesses occur. In the fourth week, fever starts to decline. This marks the final stage. Diagnosis. The most common test is the Widal test. The test involves reaction of Salmonella antibodies with antigen O and antigen H. Bone marrow, blood, and stool cultures are also done to diagnose typhoid fever. Transmission. The bacteria are transmitted to the foods by flying insects. The food is eaten by people, which may cause the infection. Infected people may become asymptomatic carriers. They continuously excrete bacteria and infect others, especially if they handle food. Treatment. Typhoid fever is mostly treated with fluoroquinolone like ciprofloxacin if there are no incidences of resistance. Since typhoid fever is not a fatal disease, antibiotic like chloramphenicol, ampicillin, and amoxicillin can easily treat the disease. Untreated typhoid fever lasts for about 3 to 4 weeks with death cases of between 10% and 30%. Statistics. Typhoid is listed among the reportable diseases in South Carolina, but it is not common. Children and young adults between the age of 5 and 19 years are more prone to typhoid fever than mature and old persons. Environmental and lifestyle factors. Lack of potable water supply or proper sewerage system in the surrounding environment increases risks of contracting typhoid fever. Water and food are the main agents in the spread of typhoid. Clean environment control breeding of flying insect which aid in the transmission of bacteria to food and water. Healthy lifestyle like drinking boiled or chlorinated water reduces chances of infection. Proper disposal of human feces through use of either pit latrines or water closets enhances a clean environment. However, some communities are ignorant on practicing a healthy lifestyle. Some people argue that boiled water is tasteless. Poor communities cannot afford facilities like proper sewer system and hand washing facilities in their living environment. This explains why many incidences of the disease are recorded among the poor than among the rich. Children of busy parent may be neglected. Young children get any object into their mouth. Eating of raw foods also predisposes individuals to Salmonella typhi infection. Prevention strategies. Proper sanitation and hygiene practices are fundamental in preventing typhoid. Proper food and water handling, this prevents any possible contamination with the human feces. Parents should pay great attention on their children, control what they eat especially when they are crawling. Public health departments should educate people on hand washing. Washing hands after defecating and before handling of any food or water to avoid contamination with the bacteria. Water used for brushing teeth, washing fruits and utensils should be boiled or chemically treated. Children should be advised on not consuming foods from unknown sources. Administration of vaccines. The vaccines offers protection between 50% and 80%. It is a live vaccine administered orally or by injection. However, the vaccines are only recommended for travelers visiting typhoid endemic zones. Food handlers should be examined for any infection and issued with a medical certificate. All food handling premises should meet all sanitary requirements before they are licensed. The premises must have hand washing facilities and a washroom section. Treatment of infected individuals to prevent the spread of Salmonella typhi. Conclusion. Health education and promotion contribute greatly to the control of communicable diseases. Poor sanitary conditions and untreated drinking water increase the rate of typhoid fever infection. Environmental sanitation and a healthy lifestyle greatly reduce incidences of typhoid fever infection. Parents, guardians should pay close attention to their children, especially in monitoring the kind of food and water that they take. StudyCorgi.com has everything you need for successful studies. Writing tools, informative articles, and essay samples. Come check it out!